A new study tonight shows parents are split on whether or not to get their children and preteens vaccinated against COVID-19. A new Axios Ipsos poll surveyed parents of children ages 5 to 11 years old, and 44% said that they were likely to vaccinate their children, but 42% said their kids were unlikely to get the COVID-19 vaccine. This comes as Pfizer says it has submitted data to the FDA for its vaccine and in children 5 to 11 years old for that usage there. The company says it's safe and effective, so we are asking the experts what this means as we move forward. Joining me now is NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, with this new data submitted, where does that put this group of children in the timeline to getting that protection from the vaccine against COVID-19?
Good evening. We're likely looking at the first week of November for kids 5 years of age and up to be able to get the vaccine, that Pfizer shot. And so it might be a bit of surprise for all the parents out there watching that, well, gosh, I thought today's announcement meant maybe next week we'll be able to get that vaccine in arms. No, this is the start of a process. The data was first shared with the FDA today by Pfizer, but it's going to be shared over the course of multiple weeks. So that's why it's going to take until the early part of November before that emergency use authorization is rendered for 5 and up.
All right, they're still following the science there, so it'll take some extra time. Just 42% of children between the ages of 12 and 15, though, have been fully vaccinated since Pfizer shots were approved for them back in May. So with now the Delta variant and in-classroom learning as factors, what should parents be thinking about as they are looking ahead to getting those even younger kids vaccinated?
Yeah, I would encourage every parent out there to have a conversation with their pediatrician to convince themselves that these vaccines are still very safe and effective for your kids 5 years of age and up. That's the common question I get from parents. Are these vaccines safe? Are they well studied in kids 5 years of age and up? That is something every parent's going to have their own journey on, trying to convince themselves that yes, indeed, that is the case, because that's what the data shows, that amongst 2,000 individuals that were studied, 2,000 kids that were studied with the Pfizer vaccine, that dose, we try to figure out what's the right dose to give somebody that's 5 years of age and up. Turns out that they figured it out, and that this vaccine remains very safe and effective. But every parent has to have their own journey and their own conversation. They should have that conversation with their kid's pediatrician.
All right, some good advice there, Dr. Gupta. Thank you so much for your time. We appreciate it.